Welcome to my Healthy Broadband Live, a new monthly interactive broadcast designed to address the great digital divide and why it really does matter. Whether you're leading your family, organization, or community, it's important for all types of leaders to address the connectivity and knowledge gaps that really do affect our health, education, and ability to thrive economically, and to have the resources, knowledge, and tools to do something about it. Powered by the Force for Health Network, with co-hosts Lucy Howell and Dr. Robert Gillio, and in partnership with the Arizona Broadband Stakeholders Network, with coordinator Steve Peters, this live interactive broadcast explores how both the connectivity and the knowledge on how to use it really does shape our outcomes with regards to health, learning, and greater economic opportunities for everybody. Viewers are invited to engage live across Facebook, LinkedIn, and YouTube, and interact in the comments throughout the broadcast. Together, we're elevating the conversation around broadband as a basic need and showcasing the people and programs working to make inclusion a reality. This is my Healthy Broadband, and this is just the beginning. Now let's meet our co-hosts for today's episode. Welcome, everybody. This is an exciting time period. We are launching a new monthly interactive community chat called My Healthy Broadband. My name is Lucy Howell. I'm joined by my co-host, Dr. Robert Gillio, in Penn State and in State College, Pennsylvania, and our local partner here in Arizona, the Steve Peters, representing the Arizona Broadband Stakeholders Network. So welcome, everybody. I think that the intro did a good job as to why we're here, but I'd like to just go ahead and set the stage. This is an interactive community chat, so if you are watching on YouTube or LinkedIn or Facebook and you feel like you want to say something, then go ahead and put some comments in there, and if they are vetted out enough to come on to the live show, we will go ahead and talk about them, and you will also be granted a complimentary membership at the Force for Health Academy just for participating, for doing so. But let's just kind of kick this off. I've known Steve for many years. He has been instrumental in pulling together people on a weekly basis to talk about the issues and highlights and heroes that surround broadband and connectivity here in the state of Arizona. But before I give Steve the microphone, Rob, you being my partner, you being a subject matter expert, being a retired pulmonologist in the state of Pennsylvania, and having a specialty with the disparities in rural communities when it comes to broadband and connectivity, what say you as we launch off this new exciting initiative called My Healthy Broadband together?
Well, I want to react to something you just said, is rural communities have disparities, but so do urban communities. A major provider in Cleveland, Ohio, runs their cable network and their broadband right past neighborhoods that have a lot of low-income rentals to go to the higher income neighborhoods. And so those are broadband deserts, as well as when I worked in central Pennsylvania, where I live now, the rural communities are really struggling as well, not only with the disparity of not being provided broadband, but also the issue of they're the ones who need it most. They're a distance from the hospital, they don't have cars, or they don't have money for gas, or they can't take time off of their jobs. Broadband is crucial in underserved neighborhoods. And I've said this before, and I say it often, it's as important as electrification was in the 30s. It's important as indoor plumbing was in the 20s. It's a utility we all need and should fight for our fellow citizens.
Well, and thank you for that, Rob, because you're absolutely right. I mean, my grandma down the street in Tucson, Arizona, if she's not digitally connected, she may be at risk with, access to prescriptions or access to her, medical records. Steve, I want to kind of give you the spotlight here. You've been running this cohort, this Arizona Broadband Stakeholders Network for, gosh, how long has it been? Tell us a little bit about you. Tell the audience who you are and why we are doing what we are doing right now.
Right. So again, I'm Steve Peters. I coordinate the Arizona Broadband Stakeholder Broadband and Digital Access Task Force. And we started more years, Lucy, than I want to admit that I started the Arizona Broadband Stakeholder Network. And then when COVID hit, we decided that we needed to do something more immediate. We've been talking broadband for 25 years, and it's now exciting with all the federal money that has come about and lots of stuff that's happening. But when we started the task force, when we started the network originally, it was because I heard people say all the time, Arizona is not doing anything. Well, wrong. There was a lot of things, even then, not as much as we'd like to see, but there was a lot of stuff happening then. But because people didn't know about it, they just assumed nothing was happening. So that's how we started with the Broadband Stakeholder Network. And then again, as COVID hit, and we brought together a bunch of folks, and then as we started, we recognized clearly that it wasn't just broadband. We've been talking broadband, 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 and it became very clear that it wasn't just broadband. And if you notice the name of the task force now, it's the Arizona Broadband and Digital Access Task Force. Because we recognized at that time, when we put together our strategic plan, that we needed to talk about both broadband and digital inclusion. Now, digital inclusion was not, at that time, was not as much of a thing as it is today. But it just so happens we chose digital access, which may be politically more appropriate in today's world. So anyway, we brought together folks from universities, community colleges, K-12, nonprofit organizations, and so forth to come together. And we have been really kind of a hub to share information about what's happening in the state, what's happening nationally with broadband, digital inclusion, the policy issues, who's doing what. And most importantly is to facilitate relationships and partnerships. And that's how we ended up here with a partnership with Lucy and Force for Health. And so we're very pleased. We've been interested in telemedicine for a long time. We've had a long-standing relationship with the Arizona Telemedicine Program, and we'll continue to develop that. So we recognize from the very beginning that technology provided that opportunity to address a lot of the health issues, along with economic development, education, and so forth. And so that's really kind of what we're about. As Lucy mentioned, I'm going to make this quick, Lucy. I'm going to shut up. We meet every Thursday morning. We have been for almost 5 years. We first started out meeting at 7:30 a.m. on Monday mornings, went to 2 o'clock in the afternoon, and now we're at Thursday mornings at 8 o'clock a.m. And we have 30 to 60 people who join that call. We get briefings from the broadband office, the State Department of Education, the state library, which, by the way, we have the most amazing state library you could ever imagine. We have nonprofit organizations, universities like Kelly and ASU, University of Arizona, community colleges, and so forth. And so it's really been, for us, has been how do we help to facilitate relationships and partnerships, which are now becoming even more important as we struggle with funding for digital equity and digital inclusion, that building those relationships and partnerships is absolutely critical. So yeah, I think you all know that how important broadband is for education, for economic development, for healthcare, you name it. And now we as I was commenting to somebody earlier today, is that we've been talking about this for 20 years, but it wasn't really until well, two things. One, until the federal money hit, but also just the whole growth of the internet, that people finally began to recognize that technology was important. I had a really dear friend who, for 10 years, he was a total advocate for technology and education before anybody knew what the hell that was. And he was there talking to legislators and the State Department of Education and everybody. And at that time, people just didn't get it. And now we know how important it all is. So anyway, I invite you all, if you're interested, you're welcome to join us on Thursday mornings. It's very informative. Again, we get federal briefings. We had representatives from Senator Kelly's office and other folks who participate and share what's going on. And lots is we've been doing a series, and I'm going to stop. But we've been doing a stories, what we know, what we think we know, what we don't know about what's happening in Washington in broadband and digital inclusion. And it changes from day to day and hour to hour. And of course, then it impacts us here in Arizona. So anyway, Lucy, glad to join you, and look forward to the rest of the program.
Well, I've been active on your calls pretty regularly for the last two and a half years, right? For those of you that don't know, there was a tremendous amount of money and grants that were trickling down to be able to put connectivity and wires and hardware down to work on the connectivity, and then also grants that were going to address the digital inclusion and equity, right? And to help people learn about it. That kind of got pulled back. Some folks are a little bit, so now our foundation is a little in motion, fluid, I'll say. But being part of those calls, I was really kind of leaning in for like more of a call to action. And so I had presented out to the group, hey, listen, if anyone's interested, I'd be curious to take a deeper dive, happy to host a bi-weekly health and education task force in partnership with you guys. And so we started that this past summer, right? And we met the second and fourth Thursdays. And it may have been a group of 3 people, may have been a group of 6 or 7 people, but every single interaction mattered. And so we are excited to start taking some of those goals of that task force into fruition and motion. So some of those goals you will be hearing about next month. We will be super highlighting some of the awesome things that we're doing with the libraries. And this month, one of the goals of the task force was to actually launch a public-facing live broadcast so that we can start talking to the publics and those community leaders. Even if you're a family leader, you might not think or buy into how critically important it is for your kids to have access to digital connectivity. Yeah.
Lucy, if I can just add one quick thing, and I will stop. But I did want to emphasize that we have, in spite of the struggles of funding and the loss of federal funding, we have amazing organizations in this state, universities, community colleges, nonprofit organizations who are doing amazing work. And they're, of course, struggling for funding and so forth, but they have been charging ahead regardless of what's going on. And so I just want to really make that clear, that just because that federal money's gone doesn't mean the world has stopped. Still people doing really awesome stuff.
You're absolutely right. In fact, I think most calls we are hosting an out-of-towner or a first-timer, and their takeaway is always, holy cow, because all of the key players are around the table every single week. And I think that that's fascinating. I didn't even get a chance to preview my guest, so I'm going to kind of transition into one of those partners that we'll be meeting here shortly is Kelly Mukherjee. She is the Director of Operations for a really, really cool systems and platform called AZ1. And then later on in the show, we will be joined by Tucson Unified School District Program Manager, Teresa Caesar. And we're going to talk about how their department, they actually have a department specifically designed to support families. And we're very excited about talking about how community partners have laid into that. But without further ado, I'm going to go ahead and bring up our first guest, Kelly Mukherjee from ASU. So welcome to our first live show, Kelly. I'm excited to share with everybody what you are doing and why it's so important to kind of map stories in with data and real-time mapping. Right?
Thanks for having me, Lucy.
And I've got, let's see, I'm going to go ahead and maybe share this tab and I'm going to go ahead and drive for her because it's just a little bit easier to do that for us. But go ahead, Kelly. I'm going to go ahead and you tell me you want to do a quick intro. What is AZ1 and why are you here?
Sure, sure. Thanks for having me. First of all, Lucy, my name is Kelly Mukherjee. It's a pleasure to be here. I'm from ASU's Enterprise Technology, and today we'll be talking about As1. The As1 platform is really thanks to our CIO, Lev Gonick, who I support over at ASU. I also have to give thanks to Maricopa County because they are our sponsor in making this work happen. They awarded us $34.6 million to expand broadband, and also our mapping work here that Lucy is showcasing on the screen is part of the work that they have asked us to do. So we have created an interactive broadband map, which has interactive layers on the right-hand side, allowing you to click on and off different layers. Like if you wanted to take a look at community anchor institutions, where are the hospitals located? Where are the schools and libraries? And where are the hives? So we have also set up through this program community tech centers run by our partner IDEA, the Institute for Digital Inclusion Acceleration. And the hive concept came from Lev Gonick, our CIO. He did extensive work in Africa, then in Ohio, and then now we're so lucky to have him here in Arizona leading the charge. So he's basically taken his 4 decades of experience and brought it here to Arizona, where we have these beautiful centers decked out with technology. We even have 2 mobile EV RVs that travel across the state of Arizona to be able to provide digital skills training.
Tell us a little bit more just so that people understand what a hive is.
Sure. A hive, I mean, think of a beehive, right? The beehive really brings the community together. Everybody coexists. You can learn things together and you share things with each other. And so that's really, I think, the vibe that Lev was really trying to achieve here in Arizona. He really wanted everybody to come together, have a safe place like the libraries. The libraries are also a beautiful, safe community space for you to learn, for you to ask questions. And so we're really lucky that we also have these hives where we have digital navigators. We have people that are ready to help you maybe learn how to use Zoom, or maybe how to set up your device, or ask any kind of questions about digital access, just like Steve was talking about. It's really about getting broadband connectivity and then knowing how to safely use your devices and your internet access.
And the data in the mapping is incredible, the amount of information that's over here. But I love how you really try and increase the impact through stories. So let's talk about your community stories that you've been doing.
Sure. Thanks, Lucy. Yes, the map that Lucy is showing you right now is the map of Arizona. And you'll see pins that are in different areas of the state. Now, what do these pins represent? These pins represent community impact stories. And so we're really looking across the whole state of Arizona, wanting to fill this map up with stories from all of you, from all of the community. How has did you get a free device, or did you learn how to maybe set up an Etsy shop, and now you're making money to support your grandkids, right? And now you can send them to school because now you have a revenue stream. Or maybe, you're really grateful for the broadband access because then you can get your own degree and you can go get a great job. So what Lucy is showing here is we do have some health-related stories that I think are really important. The first one that she's showing here right now is the power of social determinants in shaping health equity. So broadband is actually considered a super determinant of health. If you don't have broadband access, so if you don't have strong internet access, can you reach your doctor through telehealth? That might not be possible, right? So it's really important, all the different nonprofit organizations that are working so hard to provide devices like AZ Mission Telecom is also helping to provide hotspots and other device programming. So we are very lucky to have a lot of great partners here in the state of Arizona. And we want to hear those stories. So that is my call to action to whoever's watching this broadcast right now. please reach out to me. We'll just make sure that, you can reach me on LinkedIn, or you can find me at ASU. So,
one of the cool things to maybe play with is just to find your neighborhood,
Yes.
right, in the state of Arizona, and see if things have been mapped there, right? Because one of the goals of our show and this initiative is to educate people on the assets. When we say a community asset, that is a resource, a tool in their own communities, right? So like our logo with the Force for Health, we have to empower the individual as well as put some pressure on the group leaders, but the individual should know and have a little bit more information about the things that are in everybody's own backyard. Starting with the libraries, starting with hives, starting at the local school resource centers. I just wanted to kind of throw that in there as we go through these. And I love the fact that you are emphasizing that the social determinant of health is a super social. I know I'm going to bring my partner back up here, Rob, not to interrupt your flow at all, but that is a huge, huge issue for him that we want the community leaders to know.
And I'd like the people watching this to think about social determinants of health is not just telemedicine. People that are poorly educated have worse health outcomes. People that are poor, have poor access to a good career or economics, can't afford their medicine, can't afford foods. People without transportation. So those social determinants of health, as you look at using the internet to register to vote, to get college degree or career training, to find the bargains on food are all important. I kind of like to look at it, Kelly. I'm a fan of my favorite movie, Apollo 13. In Apollo 13, there was a disaster. And instead of everyone, including Tom Hanks, instead of everyone focusing on what went wrong, this explosion that caused the leaking of the oxygen, that's causing the buildup of the carbon dioxide, they only had minutes to hours. They focused on what assets do they have that work. So as I look at this map and I say, oh crap, we're out here in a horrible situation. Our federal funding is dropped. Our agency is closed. Our whatever is gone. What do you have as an asset? And one of the best ways to find that asset is using the internet. Whether you're doing it digitally through your telephone or whether you're doing it through Wi-Fi, kind of like as Steve implied, it's a digital inclusion. So you can use the internet and your service and this map to figure out what do I have or where do I need to go to find that. Focus on what assets you have and do the best you can to take care of your reality health issues.
And so and I wanted to start at that social determinant of health story, Kelly, but let's go deeper now. Here's a real story from a real community member. So your case study or your story, community story on this gentleman with Parkinson's.
Sure, thank you. Right? If you'll click on Explore the Story Map, happy to take you to this story. And by the way, many of these stories, when you see As One Original in front of our story, it means it's been written by an ASU student. So we are so lucky to have a team of ASU student storytellers, which is a wonderful workforce development opportunity for them, right? They get to learn how to interview and write a story and put it together like this. So really great. Thanks, Lucy, for showcasing this story. It's one of my favorite stories on As One. Mr. Mossberger and his wife were so sweet to share their personal story with us. And if it weren't for good broadband internet access, he would not be able to get the kind of help that this story really talks about. So if you scroll down, we can take a look at some of the different pictures that showcase. So he's in the comfort of his own home and he is in a wheelchair, Mr. Mossberger. And with Parkinson's disease, he needs help with his speech therapy and with physical therapy. And so here you see him sitting in front of a computer where his wife, his caretaker, doesn't have to roll him out of the house and into a vehicle to get him to a doctor. Instead, he can stay right at home where he's comfortable and where it's easy for his caretaker to get him connected on the internet. And he's on Zoom here, connecting with his healthcare provider so he can have physical therapy and speech therapy. So if we scroll down to a few more pictures, it helps to tell the story. But our students have done a great job. And thanks to the Mossberger family for sharing this story. And then the next one shows how he's connected with his provider on the other side. Gleeful, he's getting such great help and health care.
Kelly, I want to comment on one thing. If Lucy scroll back up to the view of the patient, he is using an antique computer. That big square box, that big rectangle, that bread box on his table, he didn't have to go out and buy something special. All he needed was something to connect to the internet and a browser. That looks like a 10 or 15-year-old computer. So with just a couple bucks a month with the internet connection, it looks like he bought a better screen. But the point is, we don't need to drop thousands and thousands of dollars. It used to be $50,000. Talk to Dr. Finkelstein or Dr. Weinstein, unfortunately no longer with us. They were $50,000 per location for telemedicine. Now it's a couple bucks a month, and it can be through your telephone.
And I knew that, and that's a perfect point. It's a great segue actually to what Teresa can talk about with a gift of laptops. You really, it's great, but there's a lot that can be done with current hardware. But before I leave this, and I knew that the segment was going to go by too fast, Kelly, right? I'm just going to go to contact us, because if you have a story, well, go ahead, Kelly. It's your plea.
Yes, absolutely. We welcome all community stories here in Arizona. We want to hear from you. So if you do have a community story impact, or if you know of someone who received a free device and it changed their life, or they got connected to the internet and it changed their life, we want to hear about it. So please feel free to reach out to us. Thanks, Lucy.
And I want to end by emphasizing why it's so important to have stories when it comes to policy and change. We've seen so many people, like our congressional representatives, pulling for story because they need, right? I don't want to take your thunder, but why are stories so important?
It really shows the value, right? The stories speak for themselves. They're the testimonies that show why we need broadband connectivity to be expanded, why we need affordable connectivity options, why we need, right? So on and so forth. So the stories speak the loudest.
That's awesome. And, I kind of put this together just because we prepped, and I just wanted to fully emphasize, this, right? It's the stories from the communities that show the value of why digital inclusion efforts matter and partnerships are key. So let's keep working as one. Do you guys get that little play with I kept calling it AZ1, which sounds good, right? But it is as one. And I love the branding. I love the foundation of what as one is all about. And I do truly believe that Arizona, sorry, Rob, being from Pennsylvania, but I do believe that in the game of reality health games, that Arizona is kicking butt in many ways. And sometimes it's difficult in this conversation of ugliness and lack of civil discourse to be able to talk about real things without politicizing them. That it's just really important to have the real life stories so that you can just take politics out of it, right? So, but Kelly, we invite you to present and share a community story every month. Okay, so this is your segment to have if you would like, and hopefully we will see you next first Thursday. I believe it's November 3rd. But thank you for having us. Thank you for joining. Any final words for us before I send you backstage?
No, excited to work with everyone. So we're looking for partners as well. So please feel free to reach out. Thanks for having me today.
Awesome. Thank you so much, Kelly. All righty. Well, see, that was awesome. And that's exactly one of the reasons why just simple, bold pictures of when you talk about telehealth now not being covered by Medicare, it should mean so much more when you know people that don't have to put somebody in a car and go transport them somewhere for access, right? Telehealth matters. And if COVID amplified it, then COVID amplified it, right? I don't think that there's a way to go back. Rob, before we bring up, our next guest, and Steve, any comments about that segment?
I think the stories make it real, make it human. I think as the reimbursements for telemedicine potentially change, it raises the need for people to be trained in digital health tools, so that even if the services are not paid, there will be those who will step up and help. It's important. If someone, one of the things with the stories is if someone doesn't have the skills, to have someone in the family or in the neighborhood be that facilitator to help them get hooked up and get on Zoom. Even with a family member who is in a sense a telehealth first level of how you doing, Mr. Musburger? How you doing, Dad? So that you can figure out whether it's important enough to rally the troops to take them in. I love S1, and I love the stories.
And I have to say, one of our fearless leaders on our health and education task force, her name's Mala, and she represents the E-rate programs for the state of Arizona. We will be hearing from her and her team in later episodes, but I love that she's listening live. I just wanted to share a couple of the comments that she shared. Amazing story of Mr. Mossberger. Thanks for showing it. And also, and this is why I want her as a live guest, and we're going to have to work through that somehow, but it's painful that hotspots are not being funded through E-rates. This is exactly the type of issue that we want to make more generally known so that our representatives will feel more pressure, right? If they try and push through policies like this in terms of hotspots not being able to be funded through the programs that are originally designed to connect people. Thank you, Mala, for your feedback there.
I got to comment on Mala's comment though. Mala, on my phone, if I wish we could do what you're doing, with the libraries with hotspots. But in the meantime, I can do the settings of my phone to make it visible, and my phone becomes a virtual hotspot in a classroom, in a church, in a health fair, for someone to do homework or connect, whatever they're looking for. So anyone listening out there, learn how to use your phone and be that hotspot until we fund it appropriately through government or commercial services.
Agree. Strength of it is in question, but again, I just don't think enough community leaders know about the important significance of funding hotspots.
I agree entirely. But work with what you have till people like Mala can help change the policies, or get with Mala, get with Kelly, and reach out to your legislators and foundations and get the funds into the hands of those who can really do a good job with it.
Absolutely. Steve, final comment on that before I bring TUSC.
I mean, basically what people have said, and if we can continue to show that it's going to be a cost saving for people, even from the providers to the users, that's going to really make a difference in today's world. Just a quickie story. Years ago, I was with the St. Louis County Office of Drug Abuse Prevention, and we were fighting with the county supervisors because we wanted to see a residential treatment facility, and they said, no, we're not going to fund that, but they pay for hospital care. And that's kind of the philosophy that we've had over the years. And now this is an opportunity to be able to show the providers and the healthcare system, as well as elected officials and the users, about a whole new opportunity for healthcare.
So we're going to kind of use that to transition from, policy and public sector policy to the power of partnerships with our next guest. So our next guest, Teresa Caesar, is a program manager, like I said, with the TUSD FACE department. She's kind of been leading this project called Inspire, and I'll let her tell you a little bit more about that. And it really is driving community partnerships to help fill the gaps where those exist, and to putting more support and efforts around our families. So Teresa, welcome to My Healthy Broadband. Great to see you.
So great to see you. I'm so excited to be here. This is just so inspiring. So excited to have a seat at this table amongst all of you. Yes, just like Lucy said, I'm Teresa Caesar, and I'm one of 4 program coordinators for the Family and Community Department. So think of, how broadband delivers high-speed, seamless connectivity for diverse needs. The FACE department serves as a conduit that links families to a wide array of resources, supports, and educational opportunities. So under that umbrella, technology, healthcare, free mental health, and even virtual mental health. So we try to meet families where they are. And how we do that is we do rely heavily on our partnerships. And so just like Lucy said, we developed a network called Inspire. Here at TUSD, we love acronyms. So we got to Inspire. I mean, that alone, just you hear that word and you're like, oh, gets you, right? So Inspire stands for Integrating Networks to Support Partnerships in Resources and Education. So TUSD is big, 89 schools, 5 regions, and there's a lot of staff, a lot of partners, and things can get mixed up. So the mission is to organize, centralize, and strengthen this, and to build just a strong network within our department, but then also to then bring that through across the diverse needs of all of our TUSD students and families. That's not, oh yes, and then I love our little slideshow. I love it. Thank you. So this right here is an example of Q1 impact of some of our Inspire partners. As you can see, Starbucks, very right. You see that logo and it's just like, everyone knows. We are so grateful for their partnership. They joined us this summer for our annual Impact Tucson, which is a back to school event aimed to equip students with supplies, backpacks. We have a community fair where partners come in and table and share their resources and information. And Starbucks was huge this year, because not only did they fund the capital to bring in the food to feed our families, hot dogs and hamburgers, but they also awarded 40 students laptops. So this year, 40 high school students within TUSD got laptops, and they came right here to the resource center here in Menlo, where I work, and to see the look on the faces from the grandmas that came to pick up, the moms, it was just priceless. Because although some of these students get devices to check out, they're still limited. A lot of these devices are old. So it's just great work that we do. Another partner, of course, EEF, Educational Enrichment Foundation. Goodwill was a partner for this first quarter. And then the Murillo Foundation, they are incredible. So they had lost their son a few years back, and he loved tennis shoes and he loved golf. So in his honor, they developed the Murillo Foundation and award 2 TUSD schools every year. This is the 4th year that we've partnered with them. So imagine a whole school getting a pair of sneakers. So typically it's, 5 kids who are the best behaved or who hasn't made it to the detention. But for us to call a principal and say, every kid at your school gets a pair of shoes. It's like being in the Oprah audience. You get a shoe, you get a car, you get a car. So it's just been incredible. The impact, because of our Inspire partnerships, the impact has just grown significantly. And so it's like the broadband is a great opportunity for us to spread the word about what we're doing. If you're not our partner yet, you are welcome to join. Lots of work to do.
Teresa, I and Rob work with folks across the country, and I'm always getting to brag about things that we do here in Tucson. I'm like, oh, so do you guys have a family engagement department? Because sometimes I feel it's easier to bring resources for health improvement and outcomes through departments like yourselves, right? As opposed to going maybe standard curriculum route or, that kind of other route. And I have not come across another school district that actually has a specific department aimed at supporting families. And, you support families that are challenged with homelessness, right? Food. Talk a little bit about some of the things that you are really, forefront when it comes to supporting families. And then again, the 40 laptops from Starbucks. I mean, that wasn't even necessarily planned, right?
Yeah, it's just the miracles just keep coming. It's just been really pretty amazing. So just like Lucy said, there's so many different things. I like to think of like our department as like Marvel, right? And every department has a different superpower. So the family and the resource centers are a hub for families to come to get food monthly. We have a clothing bank. We put on classes, GED, English, movement, and you name it, we've got it. And then we have the heart department, which helps with our students that are doubled up, homeless, and we get them set up with transportation so that they can reside with their school of origin, because if they lose their home and all of a sudden they have to go from west side to east side, it's already been so traumatic. We want to make sure they still stay at their school of origin. So we work with transportation, just lots of logistics behind the scenes. And then we have youth in care. Can't forget about our population of kids. And I want to say like 80% of them are like elementary, K through third grade, that are foster. It's just, it's so tragic. So we have Javi Trudeau with that. And one day on broadband, I got to bring the team of these superheroes that I talk about, because just like Lucy said, it's pretty incredible. I've been in education a long time, and to see that we have a whole department that's here to serve our TUSD students and families in this capacity is pretty amazing. It's a blessing for sure. And not only that, we also work to partner with parents. That's really huge. So I don't know if you know that the other side of the family engagement department is we are here outside of the school, but we are also involved in the school, supporting school site contacts, principals, in helping build relationships and strengthen them. We have guidelines that every school should follow, and monthly compliance, as a matter of fact. So that on their websites, there's website compliance that has to happen, because talk about getting information that's accurate, to date. So many people rely on looking at your calendar, and if there's not that event that's on that calendar at the right time, or your minutes posted for your site council, all that stuff. So we have things behind the scenes that we're working to make sure that nobody gets left behind, no information. But yeah, so that's us in a nutshell.
And I think that, in a school district like TUSD, there used to be about 103 schools. I think that shrunk to maybe the high 80s, 90s.
Yeah.
Your family resource centers are evenly spaced. You have 4, right?
Yes.
That serve the footprint.
Exactly.
And it's very, very easy for a parent to be overwhelmed when it comes to digital connectivity. So if you're not downloading apps or feel comfortable with passwords, it's hard to be on top of maybe your kids' grades, right? Or even things that help you as a parent, because TUSC has so many resources in there. That's why I'm very, very excited to partner with you guys in the upcoming months and host some Fit Family Force challenges and some Fit Family Force trainings, and a way that we can actually help increase digital health literacy with the teens and the parents, and perhaps even bringing, abuelo, abuelita, right?
Yeah.
The grandparents to the table, because that's what I get excited about, is really activating the family. And that's what you're doing, is supporting the family at the base.
Yeah.
Steve's got a comment. Go ahead, Steve.
Yes, Steve.
So Teresa, are you aware of the Pima County Office of Digital Inclusion?
I'm not.
Well, you definitely need to connect with them, and we'll give you the information. They are doing a great job of working with people and getting computers out there, digital literacy training, and so forth. They actually have on the 7th, next week, they have a community provider forum that will be at the Literacy Connects.
Oh, yes.
8:30 to 12:30. And anybody who wants to attend is welcome to do that. That will be a great contact for you, because they were looking for ways to reach networks and stuff. You've got an awesome network and doing some great stuff.
Yeah, thank you, Steve. So we need to get connected with the right who's to make the right things happen. So, and yep. Literacy Connects is a partner of ours as well. They do our English classes. So thank you for that, Steve.
Yep.
I wrote it down.
And, I would invite you or somebody from TUSD to be joining the weekly AZBSN calls, because if there are any gaps for your families that can be addressed with some of our partners, it's amazing the assets that the partners deliver up to the table, and just people don't know about it, right? And so just kind of mapping that out and making sure that everybody, like I said, I want Arizona to kick butt when it comes to best practices for reality health games and processes and policies, but even more so, I want Tucson to lead the charge. I've been told that if you want to do anything special, you got to move out of Tucson. Like, what the heck are you talking about? Tucson is the perfect size pilot community to bring key stakeholders together and get some best practices in place. I know Rob's over there, like, smirking. Go ahead.
I love that. Grow where you're planted.
I love what's happening in Tucson because you're approaching things at the level of the individual person. Look at those case studies. The organizations like S1 that is surrounding that person with resources, connectivity, catching their story, and amplifying it. Organizations like what you're doing at the schools. But one of the things that Lucy's had this vision of something she calls a chamber of health, like a chamber of commerce. And one of the weaknesses that we've noticed in every community we've talked to is there are all these great agencies and organizations that about once a month get together. And by the end of the hour, they've all given 3-minute summaries of what they've done that month, and they all go away. And there's so much overlap and no coordination, and there's no action together for a month. And so to have a virtual boardroom where all the agencies are 24/7 in this virtual boardroom chamber, where 24/7 they can be communicating, uploading documents, collaborating, and those kinds of things. That's what's exciting. I think about you are I think the word is maven. You're a connector, not just an actor who's acting. You're connecting, and any way we can help you connect as the spokes of the wheel to your hub, and then your hub connected with Steve's hub, which is much larger, is what I get excited about. And your communities embraced it. They get it. So it's exciting to me.
Teresa, years ago, and I'm talking 15, 20 years ago, before technology is what it is today, I had been in conversation with a company that was trying to set up a network. And the whole idea was that you have people who come into one organization, and then they get referred to another organization, and they get referred to, and so they'd have to get on a bus or whatever and travel. And now you can just connect all those different organizations, so you can do one intake process. They can immediately talk to another organization rather than having to travel to that other organization to make that connection and do the intake and all of that sort of stuff. So it was a pretty cool thing, and that was 20 years ago. Yeah. It's a lot easier to do those kinds of things today.
It's amazing. Yeah.
Well, and again, go ahead.
Michelle Simon, who is the executive director of the Office of Digital Inclusion, attends our meetings on a regular basis. So it's a good way to connect with her also.
Oh, yep. In fact, Mala's throwing her contact information out right there. She is, we want to make sure that people know,
I
love it.
She was saying earlier that there was a Band-Aid until we get the fiber. That was to Rob's point earlier about using your phones. Exactly. Yeah. And so, again, I know that these segments go by quickly. I was excited to be part of your kickoff with your community partners, right, for the Impact Fair late July. And so to end this segment and to go into, I just figured we would play the little 1-minute recap video that we did with a special song that was dedicated for you guys. So this is a little recap video of Force for Health Out and About.
Gather around, let's celebrate the day. Out and about, chill out, hip hip hooray. Impact Tucson, the smiles run deep. Families thriving, communities lead. Heroes in the mix, Lacey and Teresa lead, guiding us all to fulfill the need. Come join the fun, it's a day to ignite. With laughter and joy, everything feels right. Partners united, pushing forward with grace. In Tucson's heart, we found our place.
Just some fun, right? I just wanted to go ahead and throw that up there. So again, Teresa Caesar with the FACE Department, Family Advocacy, Community, and Engagement for the state's second largest school district, Tucson Unified School District. it's important for us to support our families because we know that helping families will result in better outcomes, and incomes, right?
Right.
And that community partners make it happen. So, huge shout out to Starbucks for their all in volunteer program. Shout out to Starbucks. I mean, not only were they there in force, I think I probably saw maybe 20 or 30 green shirts that were all given away, food and drink. But the fact that I found out later that they gifted you guys 40 laptops is, amazing. So final thoughts before we say goodbye to Teresa. I know she's got a 4 o'clock. We might not be able to capture her at the end. Rob.
I think what you're doing is phenomenal. I think the 40 laptops in a given home, it's not just for one kid, it's for the entire extended family that may not even have that old bread box on their table. And with it being a laptop, it can go to work with mom or dad. It can go register to vote. It can go do a whole bunch of different things to help some folks. Congratulations on bringing it together and inspiring. Starbucks doesn't do this to all the people and all the organizations. They've done their due diligence on what you're doing, Teresa. Good job.
Yeah, thank you so much. Thank you.
And Home Depot and Target and TPD, right? Let's just call out those major partners, because I think a lot of times people in communities think that they're too big to care or to go get involved. And I loved seeing those big players there. So that's what we need more corporate presence.
Starbucks helped with that. So that all-in community initiative is they also reach out to other large organizations or businesses in the surrounding area. So they brought in Fry's.
That's right. Fry's is there.
Depot.
That's
so
right.
That was them. Our connection with them just made the connection just, multiply in abundance. And just, it was incredible.
That's amazing.
Every year. But yes, thank you for showing up, Force for Health, with your hula hoops.
You got to know your blood, you got to move your blood, and you got to give your blood, right? Okay. And Steve, final thoughts for Teresa as we...
Yeah, Teresa, next week is Digital Inclusion Week. And I know it's really kind of late. It starts on the 6th, and of course it goes on for a number of days. But again, you might want to we'll give you the contact information and contact Michelle and see if there's something she can do with you to help promote their resources in cooperation with you. It may be too late. Doesn't have to be next week, but just wanted to mention that to you.
Thank you.
It's a perfect segue, Teresa. I don't want to make you late, so thank you for joining and representing the school space, and you guys are doing such important work there, so thank you, and we look forward to working with you guys this semester on some Fit Family Force digital health literacy challenges, right?
Thank you. We look forward to it as well.
Okay, take care, Teresa.
Thank you.
Okay, so great transition and segue, Steve. Thank you for that, into our last segment. And so one of the cool things that we really wanted to put a anchor and stake down in the ground instead of like, okay, maybe we'll launch My Healthy Broadband next month, is the fact that this is the beginning of the school year. And next week is the mark of what a group called the National Digital Inclusion Alliance is responsible for promoting every year, which I know that many people on our task force are very involved and excited about how they celebrate Digital Inclusion Week. I'm bringing Kelly back up to the stage here in case she had some comments or features about this. But it's just, to me, this is a great website. We will put it in the comments and in the link. But there should really not be an excuse of like, well, I don't know, because there's too many partners giving way too many resources to go lean in and learn more. Kelly, I see you nodding. You want to make a comment on kind of some cool things that are happening with Digital Inclusion Week?
It just really warms my heart that people across our nation get so excited to lean into what NDIA has started with Digital Inclusion Week. You see maybe new t-shirts being created for people to just show their spirit. You see people giving away more laptops to enable digital connectivity, just like Dr. Rob was talking about. And so I can't wait to see what happens this year. I know here in Arizona, we're doing some work on sharing how art and digital inclusion come together. So keep your eyes open for maybe some LinkedIn posts about that. But yeah, can't wait to see what the communities come up with. People get very creative around this time of year.
Yeah, and it's just a perfect excuse to put some focus on it, right? Some of the mixed generational STEAM teams that we hosted over the last year included teens, moms and dads, great aunties, and grandparents. And to see and watch and observe the cousins or the teens help their 84-year-old aunties connect, right? Or to learn more and then present. Our whole thing is learn it, live it, share it, you know? And so to watch these 85-year-old people come up, and not only were they connected into, you know, the Force for Health, we had a project called Technology and Me. And basically, it was a 6-week long project where we compared computer systems and human health systems. And Rob helped kind of facilitate that with some partners out of Florida. And it was really awesome to see their light bulbs go off. Like, oh, so that's the inside of a computer. That's what they do. And then they would present in front of everybody the following week on that, you know? And so it is just an example of something that I loved when it came to families helping other family members be more connected in that. You know, we're leaning in towards the final. So Digital Inclusion Week next week, for whatever that means to you, you know, take it upon yourself. And maybe if you have a senior, if you have a family member that lives in a rural, and maybe even just your mom and dad, ask them, hey, rate yourself. Do you feel like you are digitally health literate? Give yourself a score. You know, if you see your doctor, are you connected to your patient portal? Would you be able to go to Walgreens app and see what your prescriptions are? I challenge everybody out there to look at somebody in their family and challenge them to ask them how they would rate their digital health literacy. And that's my tie to it. Let's go around the room for final thoughts. And I'm going to go to Steve as we lean into Digital Inclusion Week next week, and as we kick off and end out the show. Key takeaways from today's show.
Well, I mean, we've already said it all. I think we just want to encourage people to get the word out about how important this is. And it becomes even more important with all of the federal cuts and people's attitude about the politicians' attitudes about digital inclusion, that it's really important to get the stories out and to really help people understand all the opportunities that are provided by broadband and digital inclusion.
Yep. Explanation point, explanation point, explanation point. And Steve, here is your, just for those that would like to get more involved. I mean, the fact that this call Thursdays at 8:00 is free. You don't have to have some fancy schmancy membership, you know, to get involved. He hosts this network transparently for free at 8:00. So if you are part of an organization that wants to get more involved, even if you're part of the general public that wants to share their voice, Thursdays at 8:00, that QR code will go directly to their website, and you can go ahead and to get involved. So thank you for your continued leadership there, Steve. Okay, Rob, final key takeaways from our first My Healthy Broadband show.
Teresa said something about these big, huge organizations. She was impressed that even usually they say, I can only do something national. I can only do something that takes 2 years to decide. She got them to do it in her local school. But and thank you, you big corporations, keep it up. But I also, digital inclusion means something like this. That's my dog. But I've got this phone that I use every day, but I've got this phone sitting on the shelf. it's digital inclusion means giving this phone to the neighbor that doesn't have it, show them how to connect to the internet. Secondly, I've got high-speed internet that I'm paying for in my house, maybe $100 a month. It's high speed because I'm doing stuff like this, but it's high speed enough that I can give my password to my neighbor that can't afford the connectivity that I trust. And we can share the same Wi-Fi in my little neighborhood through the little router or Wi-Fi unit that's sitting on top of my mantle. So digital inclusion, you don't have to be big to do it. Individually, you can, learn about it, live it, apply it to your life, help your neighbors, and share it. Even if it's a phone that's 12 years old that still gets the internet and has Wi-Fi.
Kelly, key takeaway from today.
I love your call to actions, Lucy and Dr. Rob, of just how to take action today, how to take action right now, how to be part of Digital Inclusion Week by being aware that not everybody knows how to do maybe some simple things that we take for granted. So I love how you brought awareness, Lucy, to the fact that some people could use your help. And so don't take that for granted that you have nothing to share. I think we all have something that we can share.
And piggybacking off that, I will tell you that it's been my experience that folks that are over the age of 60 don't like to ask for help. Okay. So they're going to default to, no, I'm not interested. Don't trust it. Versus, wow, that somebody's actually trying to help me so I don't have to look like an idiot. I really feel like that's the barrier. And I think that the seniors, we just almost went through with the Digital Inclusion Equity Grant, right? Those 8 populations of vulnerability, seniors, vets, rural, English as a second language,
incarcerated
populations, and the disabled. And when you say the disabled, what a blanket term that is, right? I mean, there are visual disabled, there is audio disabled, and there is mobility disabled. So we can't just say, hey, disabled, let's have one thing that fits. We've learned so much by working simply with partners and trying to solve that. We are constantly learning and living and sharing it every day. So with that being said, we don't want you to wait until next month to connect with us. If you'd like, go ahead and come to the either Steve's Arizona Broadband Stakeholders Network call. That QR code will take you right there. Or as you will see in our outro video, join the forceforhealth.com. Join the Force for Health for free. You could download the app and start connecting into the resources. Come find our AZBSN group, and you can join it there. But the resources are out there. And as one map has already mapped all the assets out there, there's no excuse to sit back and not be connected to learn. So I'm challenging you guys to get connected and learn. So with that, thank you for joining us, everybody, and we will see you next month. Thank you for joining this episode of My Healthy Broadband. Today's program brought together cross-sector leaders committed to advancing digital equity, highlighting how broadband access really does truly empower overall health, education, and long-term community well-being for everybody. On behalf of the Force for Health Network, special thanks to our co-hosting partner, Steve Peters, and the Arizona Broadband Stakeholders Network Health and Education Task Force. And of course, to today's featured guests. To stay involved, access tools and resources, or even nominate a hero for a future segment, visit theforceforhealth.com and start by joining for free. Then search in the groups for the AZBSN Health and Education Task Force. Future episodes will stream live here on the first Thursday of each month at 3 p.m. Arizona Mountain Standard Time. Let's keep tackling the great digital divide together. One story, one connection, and one community at a time. Until next time, stay healthy, stay connected, and remember, be a force for health, for yourself, your family, and your community. Thanks for your time.